Welcome to Frankly Speaking with Dr. Wade. This show was created for and inspired by the thousands of patients I've served, so it's time for me to speak up and speak out on their behalf. With a wide range of experts, we bring you weekly insights, diving deep into topics of controversy to bust through the sugar coating that keeps you and your family stuck in the mainstream. Welcome to the show, everybody. Today we're going to talk about omeprizole or proton pump inhibitors and the importance of it. So I want to thank the several patients this morning that motivated me to get off my arse and communicate about something that's absolutely rampant. And honestly, I get so annoyed. I'm just being really human here. And I get so annoyed having to go over the same information over and over and over with patients sometimes. And I'm not annoyed at the person. I'm just annoyed at the fact that proton pump inhibitors are so commonly prescribed that it feels as though it's such a normal thing. And I know we get confused. We intertwine the words normal versus common. Just because something is common doesn't mean it's normal. There are dangers and risks that go along with proton pump inhibitors, such as omeprizole and other forms of these drugs that actually reduce the acidity in the stomach. And that's what we want to cover today is, first of all, why would somebody choose to go on a proton pump inhibitor or an antacid, whether it's over-the-counter or prescription-based? Well, first of all, it's a giant market because it is an extremely common thing. Not normal, it's a common thing. It is normal to have indigestion when our lifestyles promote indigestion. Okay, I'll reiterate that. It's normal for our body to have a imbalanced response by having a reflux, GERD, gastroesophageal reflux disease. It's actually a disorder, not a disease. You don't catch it. It's not something you can catch. It's a condition. It's a state. You can change it. And so first of all, when someone's diagnosed with GERD, then they feel like the treatment is a proton pump inhibitor. You have gastroenteric or esophageal reflux disease. And so now I have this disorder, which means I have to have this treatment, and this treatment fixes my symptoms, therefore it treats the disease. And quite frankly, that is not the case. I understand that people will choose proton pump inhibitors and something off the counter, over the counter, like tums or some other form of antacid, that will treat their symptoms that they're irritated by. I get that. But what happens is what starts out as a little short-term thing today becomes a habit tomorrow, over the next few months, over the next few years. And herein lies the challenge between being a symptom treater or treating symptoms at every bend, every time you don't feel great because your lifestyle is out of balance and or your body's out of balance, and you're just going to medicate it. Now, as parents, we're okay with saying it's bad for our kids to medicate themselves and numb themselves, but we're doing it ourselves when we show these types of behaviors. I don't feel good. I use a chemical and I drug it. I don't feel good about myself. I'm depressed. Whatever it might be, I take this drug so I can feel normal again. And I'm not here downplaying or being negative about somebody who's using those in their life to get themselves back up on their feet. But again, we're talking about perpetual use that allows us to continue the same behavior that's creating it, and we never solve that problem. We just keep treating the conditions, which relates into treating other things the same way. And now you're accumulating this problem. I'm taking this drug, and there's side effects for that, and we start treating that. Now, most of you listeners are already keen to this. When I look at my ideal audience, it sounds like I'm preaching to the choir. Whether you know somebody who's using them, whether it's a family member, your spouse, or somebody that you are aware uses PPIs, and it's just no big deal because, it's just GERD, it's just heartburn, it's just reflux, and it actually helps those symptoms. Well, what's not being shared is the many dangers that are associated with these. And I think the confusion, for example, as I was talking about it with this patient the other day, is it's no big deal because my doctor basically says it's okay. And that false sense of security, that false direction. In my opinion, it is a false direction because it's leading you down a road where you're not changing what needs to be changed or improving or getting at the cause of the indigestion. And the indigestion isn't from too high an acid. The majority of times it's from a lack of digestive acidity. And what happens is that's caused by a number of factors, one of which is a major cause for many of us, which is chronic stress, whether it be a low grade. But that tells the body basically to slow digestion and deal with what's called fight, flight, or freeze. And that fight, flight, or freeze says digestion's not important at this time. Therefore, we're not going to focus on it. We're going to focus our energy into running or the fight or the flight or the freezing. And so that anxiety changes the amount of acidity that we're going to use for digestion. So we want to discuss what normal healthy digestion looks like, what a healthy digestive process leads to, and whether or not you can heal on your own and whether or not you can correct the imbalance that you have. And I think as I've read through a number of different articles and seen research and looked through the research and seen the imbalances and the focus points, whether it be on bacterial and virus influences, bacteria such as H. pylori, Enterococcus, and the probability that increases as a result of being on PPIs. There's so much out there, and sometimes it's so noisy. Literally, there's just so much coming in from these different angles. So I want to strip that down and keep it really, really simple. First of all, if you're on a PPI, which again is a proton pump inhibitor for GERD, gastric reflux, or simply put, heartburn, and your significant other, your honey, your loved one, is something you just say, hey, okay, take this over the counter. It must be okay if it's over the counter. Not necessarily true. And it must be considered okay because Western medicine labels it as a proper standard of care. So back in 1998, when proton pump inhibitors came on the market, they were used to treat the effects or the symptoms of heartburn and reflux, indigestion. And so the theory behind that is that you have too much acid, so we're going to knock the acid down. Now, there's a couple things that are really not accurate here. And the scary thing is the symptom does change, and yet it allows you to have deeper issues. And there's only a couple of the many issues that I want to address today, just because they're very basic fundamentals about long-term health, and they're things that if you choose to ignore, you will be dealing with later. And what we want to talk about is the options to deal with it now may not be as bad as you might think or as challenging as you might think. And you can actually get that under control on your own and start to reestablish a healthy digestive process, which will have a downstream effect on your body from a bone mineralization, from a healthy connective tissue, which means alignment and stability and structural integrity of your body. All these tie in when you don't actually digest and absorb well. So the overuse of the PPIs, first of all, they're kind of off-label. They're off-label from the fact that they only recommended to be used no more than 8 weeks, and yet people are using them. And I've had patients that have been on their omeprizole and something like that, a PPI, for 20 years. There is serious damage that occurs as a result of the long-term use of these PPIs, both from a stomach lining and absorption standpoint, which research is starting to show more and more of. But let's keep this quite simple and talk about some of the risks that go along with PPIs, why we want to consider what we're doing with them before we do this too long. And just looking at options, because again, I understand that when a patient looks at heartburn or reflux, or looking to alleviate those symptoms, in many cases they start out with short-term strategy to get some relief, but turns out that it's a habit and that it becomes more and more of a pattern to relieve that, whether it starts out over the counter and then ends up with a prescription or vice versa. And in many cases, it's just that long use that's extended over time. So let's talk about First of all, the symptoms of GERD, the symptoms of reflux, heartburn, indigestion. There's also the secondary symptoms of a dry, scratchy cough. And there's also part of fatigue after you eat, which is postprandial fatigue, which many don't associate with indigestion. But we're going to talk about what that looks like and what that means, actually. When you step back and you see the bigger picture of what the body's trying to do, you've heard an episode we talked about homeostasis. That will come back again and again and again because everything the body's processes are focused on is homeostasis, maintaining that inner balance, that inner symmetry to allow the body to continue to not only survive, but adapt to the present moment. And it's not thinking long term, it's thinking now. It's thinking in this moment, what do I have to shift, change, adapt, rob Peter to pay Paul to keep this thing going, to adapt to the environment that I'm in currently. And therein lies what we call the secret to health, is the ability to adapt and adapt efficiently. And that enhances your body's ability to interact in the environment. And that's ultimately the decision maker that's going to keep the body rolling. So a whole nother topic. But with digestion, it still plays a role. It plays a huge role in it. And when you're having indigestion and you start a reflux med like a PPI, you have to understand. There was an article that was written by the Kresser Institute, Chris Kresser, and it was pretty cool. It definitely highlights a couple things here, and it's literally called the 8 more reasons to avoid proton pump inhibitors. And I will rattle off just a couple of those right out of the gate in reference to Chris's article. PPIs increase the risk of serious gut infections. Number 2, their increased use is associated with SIBO, which is small intestinal bacterial overgrowth. So of the 2 parts of the colon specifically, there's several parts, but the small intestine, which is right below the stomach, that is where you have a smaller amount of bacteria. And with repeated antibiotic use and other stresses to the body, you can create what's called SIBO, that small intestinal bacterial overgrowth in that area, which then actually, when you're taking a probiotic, begins to work against you. You're actually feeding the wrong bacteria in the wrong region. And this is, again, a trendy thing where people are like, hey, I'm taking a probiotic, so that's improved my digestion. And the real question comes back into is, if it did improve your digestion, great, but is it solving your stomach absorption and digestion problem? No, it's not, because there's a misnomer, at least what I see with interactions with patients, is that specifically they think they're affecting the stomach, the actual stomach above, not, people reference the stomach as the large intestine, small intestine, and the stomach. And the stomach is the bagpipe organ above, okay, the intestines. The duodenum then is where you drain into, and that's the chyme, and the bolus, that the food just literally should drip into the duodenum. That's where you start to, when food is properly digested, that's where you begin to absorb the nutrients. And that whole process of absorption is set up by the pre-digestion and how much the stomach and your enzymes have naturally actually created for that. So that's where you can run into problems again, is repeated use creates SIBO. Number 3, PPIs alter the microbiota to exacerbate liver disease. Plenty of studies supporting that. PPIs increase the risk of stroke. They can cause an evolutionary mismatch. So the micronutrient malabsorption is one thing we'll get into. Number 6 is PPI use is associated with iron deficiency. And PPI use during pregnancy may increase childhood asthma. And number 8 is PPIs increase the risk of death by basically 1.25 to 1.5 times when the individual. So For example, the risk increased with time of use, and those who had used PPIs for over a year had a 1.5 time increase of death. Now, some of you are thinking, wow, I've been on this thing for 6 years. I've been on this thing for 9 years. I've been on it for 3 or 17, whatever it might be. This is about an awareness, and you have to understand what the intention here is. The objective is you are alleviating the symptoms of indigestion, and you're doing so with a drug that's creating, ultimately, a reduction in stomach acid. And the problem is you were told originally that stomach acid was your problem, which makes the PPI or the antacid make more sense. But here's where you've been, in many cases, fooled or led astray. Again, knowing the symptoms change, but what's happening is you're creating this deficiency on the other end, and more commonly, weak connective tissue, and I'll fill that gap in. So if you heard me a while back, it was on another episode about disc injections, and there were several patients that taught me a huge part of what role predigested proteins play in the connective tissue or the structure of the body, the structural stability. So when we talk about connective tissue, we're talking about ligaments, we're talking about fascia, we're talking about the discs in the spinal joints, we're talking about all the joints of the body. So that connective tissue, in addition, muscle's a part of that, but mainly we're talking about the less vascularized tissue, which is where we're going to actually see such a structural change. So interestingly enough, your body, we're back to macronutrients, which are proteins, carbs, and fats. Your body needs proteins for rebuilding and regeneration. It uses fats for some rebuilding and regeneration, but mostly for energy. And carbohydrates you can do without. Now, I'm not saying, again, you have to do without them, but again, you can survive without those carbohydrates. Now, yes, your brain needs sugar, glucose. It can make it in other ways. Yes, your eyes, your organs, such as the heart. But you can also adapt towards fat, which is that ketogenic style. Now, let's not jump into that so much as we want to come back around with the digestive process. You have the ability when your acid levels are within a normal range. Now, what's normal? When you digest food, there's several things that happen. And in summary, you have 3 glands specifically up in the facial and around the mouth area, which are the sublingual, which is under the tongue. You have the submandibular, which is under the jaw, and you have the parotid glands. These glands are designed for when chewing in your saliva, such as Pavlov's reflex, Pavlov's dog, is that every time they heard the bell, they started salivating because it was associated with food that trained their system to respond. And so that learned response, when you chew, however, you are creating saliva, which is actually creating enzymes, and those enzymes are released from those glands, rather, and you are beginning the digestive process. It's predigestion. So in reference to a cow or a horse, they have secondary and tertiary stomach that actually allows them to chew their food, and then they chew their cud, if you've heard that. And so they'll be laying around in the field and they're just chewing after they've been up eating and foraging for a while. And then they'll go back and they'll lie down and they'll just regurgitate, and their second stomach does a lot of that digestive process for them, which then, and again, another topic, but translates towards the food and the value that we have through eating those sources of animal proteins. They're the ones that assimilate a lot of the phytonutrients and phytochemicals, break them down for us, and then we get them in that food. Whole nother topic. As we digest and our enzymes rather start that predigestive process, as food's coming down into the stomach's preparing. That pH, again, chewing is stimulating your autonomic nervous system through your vagal nerve and a number of other neurologic processes, but your body basically is setting the stage for digestion. The normal pH of the stomach for digestion is 1.0 to 2.0. And again, there's arguable, specifics with that, but it is literally down to 1 to 2 pH. That level of pH is going to allow the HCl to be antimicrobial and to be a first line of defense for pathogens that come into the body. So you already create somebody who gets food poisoning often, again, usually has low HCl levels. But what this triggers is when you cannot produce enough acid in the stomach to bring that level down, you don't create pepsinogen, which then converts to pepsin. Now, what that means is these are enzymes that are released to digest proteins. They are released upon the pH being low enough to release them and create them. Therein lies your natural ability to properly digest protein and other nutrients. So when you don't have enough acid, or when you are a higher pH, let's say 4, 5, 6, and you're not digesting food well, why would that happen? Chronic stress depletes the mucosal lining, which, again, you've heard of ulcers, and you've learned about ulcers, and there is bacteria present when there's ulcers. But I'm going to ask this question as well. Where is it coming from? Is it coming from the weakness in the body and the bacteria is opportunistic, or is the bacteria causing the problem? Whether we're talking chicken or the egg in this case, I want you to step back for a second and think physiological function. That's what we want to restore. The antacid drug, the PPI, is not restoring function. It's basically covering up the symptoms of low acid, of low acid or a high pH in this case. So if you don't digest your food well because you have a lack of a mucosal lining, your body's not going to burn itself. It's going to shut that pump off. If it's going to burn itself, then basically you are reducing your acid production. And when you reduce your acid production, food does not digest properly and it hangs out in the stomach longer than normal in amounts that are, again, not normal, so they creep up to that esophageal sphincter and stress that area, and that's where you can get creep up into the esophagus area. Now, there are a number of different causes, from overeating to drinking too much while we eat, a number of things, and not just alcohol, but literally fluids and whatnot. So when we talk about absorption and healthy digestion, you want to understand first, chewing is essential, and to chew properly and chew enough. Your mom might have said, at least mine did, chew 30 times, chew 40 times, whatever it is. 30 is plenty to start to break down the food, and you really want to encase the food particles with saliva, and that's what begins that digestive process as it goes down into the stomach, and the stomach acid has been increased because the mucosal lining is thick enough. The lining of the stomach allows the pH to get that low. Again, that's the body's natural protective mechanism for the stomach wall. So you have this mucous membrane that allows acidity to go up so that not only can you kill bacteria and pathogens that come in the food, which will happen, and it does happen all the time, your body breaks a lot of that down in the stomach and kills it. If you don't have enough acid, that's not happening. Again, you're getting now bacterial and other pathogens in there that are disrupting the system and putting your body into fight or flight, or releasing, then we start to release more cytokines and histamines and that sort of thing, which we can get into. But again, we're talking about natural digestion. And what happens with the proton pump inhibitor is, again, you're taking that acid level down even more. You're changing the symptomatic side of it, but you're putting a greater burden on the liver, the gallbladder, and the pancreas, and therefore the colon. And ultimately, what I want to share is the lack of normal digestion as a result of the long-term use, even though you're covering up your symptoms and you feel like you're doing okay because your doctor implied this is okay, just be on it. And there's really no reason for them to take you off of that. There's no incentive. There's no rebalancing that equation. So this information is about having you first just understand you're reducing your body's ability to absorb not only things such as magnesium and calcium, which are for bone, but you're also reducing protein absorption as a lack of enough acid, which then does not allow you to convert pepsinogen to pepsin. When you under-digest that, and you're actually putting a load on the colon and whether it be the small intestine and the large intestine, you're promoting SIBO, you're promoting imbalances in the colon, you're promoting more of a fecal stress to the body, which then puts a greater load on the kidneys and the liver to recycle things. So how do you know that it's affecting you? Well, patients don't hold alignment well. That's one indication. They will have chronic inflammation. They'll be wearing joints out, and they'll be told that they just have osteoarthritis, completely separate condition. They'll struggle back and forth with constipation or diarrhea. So the colon is either too compacted or it's too loose, and it does waffle and from one to the other. When there's too much constipation, then all of a sudden the body, then the person usually wants to flush something out, and they're recommended to take something like Miralax, which is a lower stressed form of a drug to move the colon. However, there's still an antagonism that goes on that irritates the colon. When you look at demanding so much fiber in there versus getting it in your diet naturally in regular amounts, and you start to clean up the physiology upstream, you're going to hear me say upstream or downstream. So upstream is looking at how you chew your food and managing your stress, and then how you actually improve the function of your stomach. And when you improve the function of your stomach and you replenish that mucosal lining, you have a chance to return digestion to a more normal state, and now you're not stressing things like the liver, the gallbladder, the pancreas, the rest of the colon, and ultimately the heart when these areas are chronically irritated and inflamed. So the PPIs have a great impact on overall systems of the body. You just don't always know it because you're treating one thing thinking you've solved that problem medically, but actually you're creating another set of problems, a scenario, and sequelae, as we call them, which are after effects downstream that you're not associating and your doctor certainly isn't. They're just going to treat that with another drug. So again, what stimulated this conversation is patients that nonchalantly continue to take PPIs as though their problem is solved, and they're just going to continue to do this for years, and they've already been on it for years, and they're completely unaware of why their health is declining in these other areas, like I said, musculoskeletally and or from an inflammatory standpoint, and they're not seeing the link because, again, their doctor's not going to link that up for them. So, number one, this is about awareness, and two, it's about understanding what normal digestion looks like, and then how you physiologically and how you can restore normal function, and how we do that every day with patients. And thirdly, how you start to change the direction of your body's inflammatory state or the level of inflammation in the body. And again, this is back to feeling better, feeling good, and restoring balance, and then getting off the medications that are going to perpetuate more medications down the road. So unless you see that connection between protein absorption, the inability to have healthy connective tissue, which is your structural integrity, again, the onslaught of all these other secondary and tertiary things are linked up to, can you absorb your nutrients, and what was your body's first clue that you weren't absorbing nutrients well? So the reflux was telling you there was a functional and a physiological problem, not that you're lacking in proton pump inhibitors or that theoretically you have too much acid. You have undigested food that creates an abnormal level of acidity in areas where you're not going to have them. But when digestion is improved through healthy levels of HCl and acidity in the stomach, then you're actually going to digest and process your foods more efficiently, and therein lies the real solution to this whole problem. And again, you can increase your protein absorption, and then you can, otherwise you're going to keep taking the reflux med, and we're going to keep trying to treat the symptoms of those other things that are relating to your improper digestion and absorption. And if you want to dig more into those studies, they're out there in terms of Chris Kresser has a great link in terms of what he's showing there. And there are certainly case after case in my office where when we've addressed it, we can turn digestion around. We are not treating heartburn. We're not treating any conditions as much as we're restoring normal function of the body and improving upstream where the body's lacking that balance and that normal function. And what happens is the body ends up healing and people can restore and regain their balance again. That said, I'd love any questions you guys have or insights. The 3 takeaways here today are: chew your food better. Ask your doctor if it's possible that you get off, that you wean yourself off the PPI, and what's the solution long term. And if your doctor does not have that answer for you, guess what? It's time for a new doctor. And that's the real message is you have to have a doctor that is batting for you, not just giving you a drug for every symptom you have. Again, some of you, but not particularly in this audience, that is not good enough to just, you have a symptom, give me this drug. That's not where we're coming from. We're coming from awareness. We're coming from an educational process to be able to take charge of your health, to ask better questions with your doctor. And your doctor should not be frustrated, disgruntled, or irritated by your questions. What's fascinating is I hear this all the time. It's an irritation that you're actually asking the question. How dare you ask that question? That, to me, is fascinating. I love the questions. Not that I love to answer 21 questions every time I see a patient, but I love the fact that a patient's engaged. I love that they're asking questions, that they want to know, that they care, and that they're looking for an alternative that suits them. And I'm happy to do that. And that's one thing that's been brilliant about patient care is helping patients solve problems, like I said, upstream and actually dealing with them and restoring balance to the body. So anyway, chew your food better. Give your body a chance to physiologically change. Add nutrients that restore mucosal lining. We have 2 products specifically in our office that someone would start out on. And what happens is that actually replenishes and rebalances that mucosal lining. It isn't a treatment for the condition. It's a functional restoring of it. And so what happens is the body then starts to heal. That mucosal lining starts to come back. And all of a sudden pH levels start to improve. And then with enzymes, you can get very, very specific. And I'm also referring to metabolic and therapeutic enzymes, not just digestive enzymes. Again, you create your own enzymes in your body, but as we age, we do reduce those areas in our body that create enzymes. We don't have an infinite amount, so they deplete as we age. And there's several things that actually support that part. So our food and nutrients, the more raw we get with it, happens to be where the enzymes are. And again, GMOs are contributing to a lack of enzymes in the body because GMOs are preserved by actually having less enzymes in them, which means it's harder for them to be digested, and that's why we get a histamine response with them in many cases. So we'll talk about that down the road, but those are another contributing factor as to the food you're continuing to consume that will continue to create a digestive load on the body, increasing the digestive load or the digestive burden on the body, which then prevents, again, it puts that strain on the system to start, and you're sitting there innocently going, why do I feel like crap? And there are a number of reasons you feel like crap, but this is one basic one that has to be addressed. You have to understand, first, you have to be able to digest nutrients. You're not what you eat. You are what you digest. I'll repeat it. You're not what you eat. You are what you digest. And if you don't digest well, then you're going to be a weak body. You're going to be a weak connective tissue. You're going to be inflamed. You're going to be degenerating more than you're regenerating. You might not feel the pain, but you're not going to be replenishing. So you're asking your body for dis-ease. You're moving it right into that fast track, which again is also premature degeneration, which is premature aging. Everyone put their hands up that really wants to age faster than normal. I didn't think so. None of us want that. So we want to slow that train down as much as possible. Thank you so much for listening to this episode. Please direct any questions to our Facebook page or PM me, the Frankly Speaking Dr. Wade at Facebook. I would love to be able to either point you in a direction or get you some help. Have a great day. Okay, my fellow health warriors, it's time to head over to iTunes, franklyspeakingdrwade.com. There, you can rate, review, and subscribe, as well as share so more of our brothers and sisters can grow to realize their voice. Speaking up means you matter. So, get on it. This podcast is for information purposes only. The statements and views expressed are not medical advice and are not meant to replace the medical advice of your doctor. This podcast, including Dr. Wade Anunson and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about the guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for such services or product. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.